Now we're a handful of weeks into the new year, but it is never too late to start thinking about health care costs. It's one of the main drivers of bankruptcy in this country. Unfortunately, probably a lot of the reasons why a lot of people want, a public option to resolve that. But until then, you have to be prepared so you avoid unexpected bills and things that can really derail your financial picture. And healthcare costs overall continue to rise faster than inflation. And so the more you're exposed to that, the bigger bite of inflation will take out of your investments and your nest egg. Now, how do you keep healthcare costs down in the year ahead? First is obviously get covered through your work. 164.7 million Americans get covered by their work, but 21 million Americans get covered through the federal healthcare.gov portal. So make sure you head over there. That's the simple thing. And then it's about understanding whether your provider is in network. So just because it was in network last year doesn't mean that they're going to be in network this year either. So you want to double check. And you can usually do that on your health insurance company's website. And this is very important because the cost can be dramatically different. And so you don't want to be blindsided that, I spent this much last year, and then suddenly it goes up, sometimes 3, 4, 5-fold if you're out of network in the next year. Now, what's great is that there is something called the no surprise law, and it took effect in 2022. What this does is it limits when you are in emergency situations, when your doctor might be in network, but you get, for example, an anesthesiologist that's out of network, and then you're charged dramatically for the anesthesiologist when you had no real say in that, right? You're just blindsided by some practitioner that is working on you that is out of network. So that's the good thing. But it's very often that the insured actually bills you in the wrong way, overbills you, or even denies you coverage, and you can appeal. You're entitled to appeal. Just because you get that bill doesn't mean that's set in stone. So don't think that you have no recourse or any actions you can take to stop it. You do. It's called the appeal, and don't hesitate to use it. Next is review your medication. Once again, this is just because it's covered one year doesn't mean it's going to be covered the same amount next year. Now, there is some government pressure for these called PBMs, pharmacy benefit managers, that are raising insulin prices and driving out cheaper generics in order to make more money. So the good thing is there's some political pressure here, but you always want to check with your pharmacist in the new year if your prescriptions remain covered. Now, the good news is for Medicare patients, you have a new $2,000 annual cap of out-of-pocket prescription drug costs. This is because of the Inflation Reduction Act. And it was mainly to target cancer patients, saying, if you have cancer, a lot of those cancer drugs are extremely expensive. You're on Medicare, that's capped at $2,000 annually. So that's a good thing, but make sure you check those costs. And then lastly, look at your deductible and how much that might change from year to year, because you might keep the same plan, but the deductible can change. And a lot of people focus on silver plans, cheaper plans, but you really have to align your healthcare needs with what's covered. And once again, that changes every year. It's kind of like the tax code. Tax code can change from year to year. And you need to kind of stay up to speed on those changes.